So, Dr. Phil, one of the things that I think is most intriguing in reading up on suicide is this whole concept of suicide contagion. Tell me what that is and how legitimate that concept of suicide contagion or copycat suicide is.
Well, it is sadly a very real and legitimate concept. There are ethical guidelines for the media in how to cover that sort of thing, because the things that you typically see on the news, the memorials where people come and bring flowers and the heartfelt interviews and everyone talking about them, contribute to this copycat effect, because those that are trapped in a really bad place in their life and that maybe even remotely considering it, they look at that and say, wow, I would love for people to do that for me.
And in the past, we, and I say we meaning media, played a huge role in it, but now with social media, this whole idea of, I think, suicide contagion has really leapt off the page. The Academy actually sent out a tweet that was heartfelt, but I worry if it sent the wrong message. It said, "Jeannie, you're free."
And I understand the intent, and there's no malicious intent in a tweet like that, as you know, but it can send a wrong message.
So what is the message to people who are obviously following this story, and there are people at home watching right now feeling depressed and thinking about maybe taking their own life?
There are so many patients that I've been called in to help with in the emergency room after a suicide attempt. And I can tell you that the vast, vast majority of those people will tell you it seemed like a good idea at the time, but they're so glad they failed. People that kill themselves believe that the world is better off without them. That is so untrue. It leaves carnage in its path. Don't do it. Ask for help. Pick up, and you're looking right now on the bottom of the screen at the suicide hotline number. Call that hotline. They will not pressure you. You don't have to give your name. They will talk to you. They will listen. There are people that care. There are resources out there, and it does get better. It does get better.